This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Hey everyone, I'm Monica Robbins. Thank you so much for tuning into Health Yeah, your prescription for clear, concise medical health and wellness information. This episode is part 3 of a 3-part series on gender affirmation surgery, specifically phalloplasty, which is creating a penis, typically using the skin of a patient's arm. In part 1, I introduced you to the patient. In part 2, we learned more about this complex procedure with Dr. Gupta. And in this episode, we learn more about the plastic surgery aspect of this procedure with Dr. Tobias Long from University Hospitals, Cleveland Medical Center's LGBTQ and Gender Care Services Clinic.
As a plastic surgeon, how did you get in this line?
Sort of going into it, I was, general reconstructive plastics. It's kind of what they needed at the time. And it fit my skill set with also focus on cosmetics and everything. But I did have a lot of training and exposure to gender affirming surgery in training. So that obviously, gave me an interest in it. And when those consults started coming in, a couple with, Isaac and Robert being some of the first ones with top surgery, I was like, yeah, I can do this. I love this surgery. We'll get it done. And then I met Dr. Gupta early on. Actually, I interviewed him when he came up here from Kentucky. And then when he started, we just meshed really well. And he's done a great job of really growing the whole service line. Even a couple years ago when I was training and say, I did a case, with one of my attendings. It was even, kind of like depending on who I was talking to, there was a little bit of like hesitation. It's really changed in the last few years as far as that aspect. It's been, it's just really, people are just want to know what do you do? Like, how do you do the surgery? And there's a lot more kind of social acceptance, which is great, both for the practice, for the patients. So as far as, a lot of it is like surgical details or what people want to know, like, exactly like, for the bottom surgery, the most commonly thing is about the phalloplasties. Where do you take the tissue? How do you make a phallus? People want to know that does it work? Stuff like that. But it's definitely a hot topic at parties when it comes up.
So in Bobby's case, he told me he's doing forearm, correct? Is that pretty much the standard?
Yes. Yeah. It gives the most aesthetically matching phallus that you can do, because the tissue, when you roll it from the forearm, really it makes a nice anatomic phallus, rather than in the other options being the thigh and there's other tissues with the back and stuff. It just either it's too thick, it's too big, then you have to do what we call debulking procedures, where you have to actually make it smaller. And then also the anatomy between hooking up the nerves and the vessels really works well. So it gets the best for having sensation, both, skin sensation and erogenous sensation. It's by far the most successful there. So we try to, Dr. Gupta and I both try to sort of lean patients towards the forearm. Now there are some cases where if they've had previous trauma or other things that you can't use that. And then, obviously you got to use, other options, but it's if it's available, it's by far the best phallus reconstruction. Pretty much for any bottom surgery, it's never a once and done thing. If we're talking specifically about phalloplasty, it's 3 stages, and it's about 12 to 15 months. So it's a huge buy-in for these patients are working, they've got kids, so it's a lot of coordination and everything to make it happen. But stage 1 is probably the longest, the most kind of complex of the procedures, where you're actually creating the phallus, taking the tissue from the forearm, bringing it down to the groin, hooking up the arteries, the veins, the nerves. And then the second stage is stage 2 is typically where the vaginectomy is done. And then also you use the labia to recreate a scrotum. And then stage 3 is the implants, whether it's, a phallus implant for, erect function, or also testicular implants. So that's sort of the fine tuning, that can almost be done outpatient or overnight. So it's a lot less involved, but it does involve 3 stages. And then in between stage 1, stage 2, there's a skin grafting where we delay skin grafting the arm because at the time of the first stage, we like to use a skin substitute to really create a more anatomic reconstruction for the donor site. I think that's really benefited patients as far as, really reducing any complications with tendon exposure or delayed healing in the forearm. And then it gets a nice, you fill out the tissues, you get a nice skin graft on there, and they can even go as far as to getting it tattooed down the line. And you can really even almost hide that donor site completely down once it's all healed up. So it's good. We've definitely come a long way, and it's something that it's much, not necessarily easier, but safer to do where you're not traveling, versus you have a little bit more leeway with the vaginoplasties. But the big thing with it is it's microsurgery. So anytime you hook up, you're taking tissue from one part of the body to another, hooking up arteries and veins. This is something we routinely do in plastic surgery for all sorts of reconstruction. The big conversation to have is if there is a clot in the artery or the vein, usually that happens. If it's going to happen, it's going to happen in the first 24, 48 hours statistically. So that's why we have to have patients in the hospital. We have to be watching them closely. Even, for the first 24 hours, it's every hour we're checking on those blood vessels. And because if that clot forms, then you got to be able to have the option of going back to the operating room to be able to figure out what's going on, try to salvage the reconstruction. And, typically you just want to avoid having to go down that path. But we're talking, this is getting to the point where we're like 3% when you look at a national statistic rate of that happening, of losing a reconstruction completely. We are doing a great job so far at University Hospitals, being even below that. So it's very safe. It's a conversation that I have to have, and Dr. Gupta has it too with all our patients, just so they have to be aware of it, and you want them to be informed. But it's definitely safe, and it's been proven to be a great technique. Obviously in the right hands.
Why did we need a center here in Northeast Ohio and in Cleveland? Why was it important that you guys even got together and started doing this?
Well, one, there's a population for it here. There's demographic, and it's a huge, just not even in Ohio, but I think, my hope would be that these centers continue to grow because it's a huge underserved population. And what Dr. Gupta has really done an awesome job in driving is this whole multidisciplinary focus on the LGBTQ plus community, and being able to both have providers that are open to the population who want to help them out, who are focused in this kind of medicine. It really that's sort of the underlying, it's awesome what we're doing, but there's this whole or bigger picture of just being able to address this community and health concerns on just like a primary care basis and stuff. And that's it's really he's really pioneered it here, and it's definitely not the way that a lot of places even across on a national basis are doing it yet. So it's pretty cool.
How busy are you with this particular population? I'm assuming you do both. You'll do, but how busy are you? Like, let's say one of the easiest things I would assume is top surgery for both. So how busy are you at your clinic, and how many of your patients really don't, unlike Bobby who had to come in 2 hours, how many of your patients really don't have to travel that far?
So it's gone from, I'd say maybe a year ago where it was, maybe a few patients a month, to now it's every week. And now we're doing surgeries on a weekly basis, and it's going to be at this trajectory, it's going to be once a week. And it's really kind of taken over. I've actually, to prioritize the gender affirming surgery, I've slowed down on a lot of other things that I was doing, because there's a whole other world of plastic surgery that I do too. But I've really gotten to a point where this is almost, right now it's about 50% of my practice, and it's, if anything, it's going to be more. So it's definitely increased from patients coming in. It's probably, I'd say about the majority, about 3/4 of the patients are local. So it's definitely inspiring to see that, they're like, and a lot of the stories are, I was looking at getting this done, and in Pennsylvania or San Francisco or Texas, and then I found that you guys are doing it right here. Like so, and it's not like those guys also do an excellent job with it, but it's much safer from both to be able to do something locally, especially this technical. It's not like a once and done surgery that people are just jumping into. I mean, they have to go through mental health reviews, they have to go through hormone therapy. There's whole guidelines that we follow. So it's a ton of work to be able to get into it and get it approved. But at the same time, that's safe because we make sure that we are screening for, because I'm sure there's patients out there that may, given a looser guideline restriction, may try to take advantage of it and end up regretting what they do. But by the time these patients are kind of signing up for surgery, they've been through the gamut. They're ready to go. They know, even as far as their community online, they know already kind of what they're looking at, what their healing process is. They share pictures openly online, and that brings a whole other point, that they have really, as a group, create a community that it almost makes our job easy.
For more information on gender affirmation surgery, please check out University Hospital's clinic website. I put a link in the podcast description. Please find me on Twitter and Instagram at Monica Robbins. Catch up on health news and future podcasts on my Facebook page, Monica Robbins WKYC. Video podcasts are uploaded to my YouTube channel. Just search Monica Robbins and please subscribe too. Keep up to date on all of your news, sports, and weather on WKYC.com and the WKYC YouTube channel, and please follow the WKYC social media accounts as well. Random acts of kindness are good for your soul. Practice them daily. I'm Monica Robbins. Until next time, have a healthy week.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.